Are you an internationally qualified nurse who has recently passed the multiple choice questions or MCQ examination to get your New Zealand nursing registration? If yes, you must know about the next exam, which is OSCE or Objective Structured Clinical Examination for registered nurses in New Zealand. In this video, I will provide you all the information you require to make sure that you're fully ready and prepared for your OSCE examination in New Zealand. If you have been following our channel, you would know that New Zealand Nursing Council has recently stopped the bridging program for registered nurses and have now moved to a competency-based assessment wherein international nurses are required to pass 2 exams to get their nursing license in New Zealand. The first exam is a theoretical exam called MCQ exam that you can take in your home country, but the second exam is a practical examination which is conducted in Christchurch, New Zealand. So the OSCE or Objective Structured Clinical Examination is a well-established assessment process which is currently being used in many countries like Australia, Canada and UK and US as well. The OSCE assesses your clinical practice and makes sure that you are a safe registered nurse to practice in New Zealand. This exam is designed to assess your nursing clinical knowledge and skills in a simulated setting, and it is set at the entry level of practice. So the OSCE for New Zealand includes 2 components. The first one is called the Orientation and Preparation Course or OPC. This is a mandatory 2-day program that you must attend at Christchurch. The goal of this program is to basically introduce nurses to the New Zealand healthcare system, the standards of practice for registered nurses, and how to be a safe registered nurse in New Zealand. The program also includes an overall guidance for your OSCE examination and also orients you to the various healthcare equipments that you might see in your simulated healthcare environment during your OSCE examination. Now, the second component is the real OSCE examination, which is the Objective Structured Clinical Examination, and in this examination you may be able to see 10 to 12 different stations. Each station will last about 10 minutes and you are required to perform a particular skill or procedure or assessment which will be clearly listed in that particular station. Once you have passed the MCQ examination, you will get a letter of invitation from the New Zealand Nursing Council to come and appear in the OSCE. You have 18 months from the date of this letter to come and complete your OSCE in New Zealand. So the OSCE is a 3-hour examination and mostly will include 10 stations. You can see the list of stations on the screen. Each station will last about 12 minutes, which includes 2 minutes of reading time, 8 minutes of performance time, and the remaining 2 minutes will be the time allocated for you to move to the next station. If you are unable to complete your scenario within the 8 minutes, you will not be given any extra time and you must move to your next station even if you have not completed your procedure. During your scenario, you might see an actor who is performing a specific task or is a patient with specific conditions, or you may also see a mannequin or a task trainer. You get 3 attempts to pass your OSCE, but remember, preparation is the key to pass OSCE. Talking about preparation, we have partnered with very reputed institutions in New Zealand who have been offering the CAP or the bridging program before and are now transitioning towards preparing the overseas nurses for OSCE. And if you are someone who's looking for some advice or help in terms of your preparation for your New Zealand OSCE, please make sure to contact us. We will leave our WhatsApp details also below, and our team can help you to pass this examination smoothly without any issues. Each station is marked by an examiner who will have a standardized assessment tool. Candidates are not only assessed on their technical skills but are also assessed on their communication or interpersonal skills as well. In terms of getting your results, you will get your results within a period of 6 weeks from your date of OSCE, and if you are successful with your OSCE, you will be provided the further instructions to complete your rest of the procedure in terms of getting your annual practicing certificate. If you have failed your OSCE, then you will be provided the information in terms of resitting the OSCE and also be provided a detailed feedback in terms of your performance in the exam. The OPC, which is a preparation course, and the OSCE examination is conducted at the Nurse Mod Simulation Center in Christchurch, New Zealand. So you will need to fly a few days before to complete your program and then appear for your OSCE examination. The OPC is conducted a week before generally your OSCE examination. In terms of the cost involved, your OPC will cost you 500 New Zealand dollars. The OSCE examination costs you 3,000 New Zealand dollars. If you fail your OSCE and you're required to resit in the examination, then in that case, you'll have to pay the resit exam fee, which is again 3,000 New Zealand dollars. Now, I am sure you must have heard about the various challenges faced by registered nurses in New Zealand in finding a suitable job in New Zealand currently. In this matter, my advice is very simple. This is normal and it happens in each of the country. If you are in this profession from a long time, you will know the demand for nurses in different countries sometimes goes very high, or sometimes are flat, or sometimes may decline. This occurs because of the simple phenomena of demand and supply of nurses. But it doesn't mean that the situation will not change. I have been in this profession from a very long time, and I can tell you the demand for nurses is never ending. Although currently the job market may be challenging, but it is also true that if you are a competent registered nurse and you're able to pass the interviews conducted by different hospitals in New Zealand and are ready to move to regional areas, you have better chances in securing a job. But if you are someone who have been unsuccessful, don't get disheartened. Things change very rapidly. Just because the job market is a little competitive right now, it doesn't mean it will not change. Now, important thing that I would like to suggest is that definitely, as per the current situation, it may not be very wise that you move yourself completely and leave your job from your home country and move to New Zealand without a job. So try and see if you can find a job being in overseas by appearing in different interviews. I hope you like the information that I have provided you regarding OSCE in this video. If you got some value out of it, make sure to subscribe to our channel and give a thumbs up to this video. Don't forget to share it with your friends who might really benefit from this information. Until next time, stay safe and stay happy.